Spondylolisthesis involves the shifting of one vertebra on another. This model here shows a vertebra, a disc, and another vertebra. And in spondylolisthesis, the vertebra actually shifts out of place. And you can see when that happens, the yellow, which is the nerve, that space becomes tighter, and that causes pain. Spondylolisthesis tends to be a condition that does not respond as well to conservative treatment as many others. Despite that, there are a subset of patients that will get better with conservative treatment, so that's usually what we try first, either physical therapy, chiropractic care, sometimes steroid injections. There are a significant portion of patients with spondylolisthesis that will need surgery. The one good thing is that patients who have surgery for spondylolisthesis are some of our most successful outcomes. Spondylolisthesis is most commonly treated with a procedure called minimally invasive spinal fusion. And the goal of that procedure is to bring the vertebra back into alignment and then fixate so that the vertebra can't slip back out of place again. And that procedure is extremely successful to alleviate pain. The questions that patients have regarding spondylolisthesis often center around when surgery should be performed, and are there ways to either delay or mitigate the need for surgery. And that often depends on the degree of pain, if they're having any neurologic problems like weakness or numbness, and how far the vertebra has slipped. The patients tend to spend 1 to 2 nights in the hospital after that surgery, but they're walking right away. I'd like these patients to be walking about 2 to 3 miles a day within 3 weeks of the operation. So you can see that the recovery is very active. There's no significant bed rest after the surgery. And the goal is to get the patient back to an active lifestyle as soon as possible.